Deciduous tooth pulp autotransplantation for the regenerative endodontic treatment of permanent teeth with pulp necrosis, a case series. This done by Prof. Zafer and his group. They are from Turkey and published in the JOE 2022. 2 decades ago, revascularization was introduced as a biologically based treatment for regenerating the pulp-dentin complex in immature teeth with pulp necrosis. In young individuals, deciduous tooth pulp may be used as a natural biological scaffold for the regenerative endodontic treatment of young permanent teeth with necrotic pulps and apical periodontitis. The present case series demonstrates the clinical and radiographic outcomes of the regenerative endodontic treatment using deciduous pulp autotransplantation in traumatized necrotic young permanent incisors. 5 previously traumatized maxillary incisors for patient of around 8 to 11.5 years old were treated with the regenerative endodontic protocol that used 2.5 sodium hypochlorite irrigation and placement of calcium hydroxide dressing in the first visit. After 4 weeks for the second visit, the intracanal medicament was removed and the whole pulp tissue removed from the neighboring maxillary deciduous canine was transplanted into the disinfected root canal without induced apical bleeding. Following placement of MTA as a coronal barrier, the access cavity was restored with an acid etch resin composite, and the root canal of the donor primary canine were filled with calcium hydroxide and also restored with an resin composite. As a result, 3 patients were followed up to 24 months and 1 patient for 12 months. All teeth demonstrate radiographic evidence of complete periapical healing, slight increase in the dentinal wall thickness, and continuous apical closure in the absence of clinical symptoms. A positive response to cold test was obtained in the first incisor at 12 months and the second one in 24 months. Based on the record period of 12 and 24 months clinical and radiographic findings, the present case series demonstrates a favorable outcome of regenerative endodontic protocol using the deciduous pulp autotransplantation in young permanent incisor with pulp necrosis.